Ken Sharman and I are here to tell you about the positive, good things in the Affordable Care Act. Okay. Most people get health insurance through their employer, but there are about 11 million people in America who buy health insurance on their own in the non-group individual market. And I'm telling you, the individual market is the wild, wild west. The insurers have applications. They ask for details about every doctor visit, every prescription drug, surgery, other medical treatments you've had in the last 10 years. And then they can even ask you for permission to ask your doctor for files even beyond that and to ask all the details. I know this from personal experience. I've been charged double for minor acne treatment. I've been denied for a heart murmur, which I had no symptoms for. So they could turn you down for any reason. And when consumers have big claims, the insurers can look through all your medical records, and if they found that you had left out some minor details, they can just drop you and not pay your claims. So this is a really bad situation in the individual market. Health policies, they could limit your coverage to $10,000, $100,000 a year, 200,000 lifetime, $1 million lifetime. The good news is that now with the Affordable Care Act, insurers can't do that anymore. There are no lifetime limits for anybody, no annual limits for anybody. People will have many more options. They can't get rejected, and they won't be charged extra for pre-existing conditions. One of the more popular provisions is plans must allow families to cover adult children up to age 26. Your kids can be in school, out of school, married, unmarried. They can be on your income tax as dependents or not, or they can even have their own employer offers of health insurance. The insurers must cover them if you want them covered under your family plan. And also, after September, any plans that started after September 2010, they can't charge cost sharing. So that's like 10% or $25. They can't charge cost sharing for preventive services, which are annual physicals, immunizations, and most types of birth control. So most, like I said before, most people get their health insurance through employers, and employers with more than 50 employees, they're generally self-insured. So there's some of the private health insurance reforms that don't cover self-insured plans. But for plans that purchase insurance, whether on your own or through your employer, there's some more reforms on that side. Maternity and mental health and preventive services have to be covered. There's going to be rate review on premium increases. The insurers have to justify any rate increases of 10% or more. The insurers must spend at least 80% or 85% on medical expenses and not on administrative expenses or profits, or they have to pay a rebate. And I know some of you have gotten rebates. There's additional consumer protections on appeals, and they have to disclose information on benefits and rate increases. Okay, so there are Medicare reforms under the Affordable Care Act. The reductions in costs of prescription drugs and preventive services don't have cost sharing. The Medicare HMO plans, they've been overpaid, so we're reducing those overpayments, and providers are given incentives for better quality care. There's funding for community health centers, trauma care programs, electronic medical records. Okay, now unlike the Bush Wars and Medicare Part D, Affordable Care Act is paid for. And there are even progressive taxes. The Medicare tax has been increased from 1.45% to 2.35%, but only for single taxpayers with incomes over $200,000 and married taxpayers over $250,000. And then there's a tax on investment income for these same income levels. So these are progressive taxes. There's also fees on health insurers, drug companies and medical device companies. And there's overpayments that have been going to Medicare providers like hospitals and home health agencies, and they're going to get paid less. Okay, now, you probably heard about Virginia does not have a Medicaid expansion. Unfortunately, the Supreme Court gave states the option. Virginia has not chosen that option, although with our new governor, let's hope we get that next year. So even though Virginia is one of the richest states in this country, we have one of the worst Medicaid programs. Right now, if you are a childless adult under 65, if you're the only way you can get on Medicaid, unless you're disabled, is your income has to be less than about $3,000 for a single person, or about $6,000 for a family of 4. That's just pretty ridiculous, right? But under Medicaid expansion, childless adults will be able to be covered with incomes up to about $16,000 for one person and $32,000 for a family of 4. And the thing is, the federal government pays for 100% of these new eligibles, for the next few years, and it phases down a little bit, but the federal government will pay 90% for all these new eligibles indefinitely. So, and there are estimates that 327,000 Virginians would be covered under Medicaid expansion, and it would cost the federal government $15 billion over 10 years, and Virginia would only have to pay less than about $1 billion over 10 years to get all those people covered. Wow. So let's hope that Terry can get this through. So, okay, so let me just summarize that you've heard about the marketplace. We have to use the federal marketplace because Virginia chose not to have its own state exchange. And you know you've all heard about problems with healthcare.gov, but the news is not as bad as you hear. 1.5 million, there have been 1.5 million completed applications on that marketplace. 1 million people have been told that they are eligible for the marketplace. 400,000 people have been told they're eligible for Medicaid. So, it's still a slow ramp up, but we've got till end of March or something to sign up in the open enrollment period. Now that's the federal marketplace, but so any citizen or legal resident can buy on the marketplace, and they can also buy outside the marketplace as well. But in the marketplace is the only place you can get a tax subsidy, and the tax subsidies are really pretty generous for people between 100 and 400% of the poverty level, so that's 11,000 to about 46,000 for a single person, up to 94,000 for a family of 4. This is if they don't have access to affordable employer plans. Another 300,000, so there's an estimate of about 800,000 people will be eligible to buy insurance in the marketplace. And then there's 800,000 people total, and 500,000 of those will get a subsidy, and 300,000 people will be able to buy without a subsidy. So there is a tax penalty. It's pretty low in 2014. It's $95 or 1% of income, whichever is higher. It's going to increase in the next few years. But the whole point is we want to encourage people to buy insurance, because this way you'll be covered for, if you're in an accident, and there are unforeseen health problems that anybody can get. So we really want to be able to cover people.
I'm Ken Sharma, and I want to talk to you about why and how we can help now that Rose told you what Affordable Care Act is all about. So I assume everybody here is a Democrat, and everybody supports the Affordable Care Act. Amen. Right? So what we need to do is get out there and encourage our family and friends and our neighbors to sign up for Affordable Care Act. They can do it either online. As Rose said, it's working much better than it did before, and it's continuing to improve every day. They can do it over the phone. They can actually go through the entire application process over the phone, a 1-800 number, and they provide lots of language supports. I think it's like 250 different languages that they support. There's personal assistance, one-on-one. Somebody will sit with you and help you fill out an application, or you can do it on a paper. We have paper forms as well, so there is no reason why people cannot apply. and you can sign up until March 31st, 2014. So there's no rush. It's not like you gotta go do it today. You can wait till next January if you want, but you should sign up if you need health care, and make sure you tell all your family and friends to do the same. Especially young invincibles, people under 30 who believe they'll never get hurt, never get sick, never have anything. They're the ones we need to join in. So I'm sure all of you have children, grandchildren, nephews, nieces, whomever you know that you see over the holiday period. Make sure you talk to them about signing up for health care, because it's going to help them and it's going to help you. And the next bullet here is something that we need to do. Terry committed to doing Medicaid expansion. We need to hold him accountable for that, because that's going to help a lot of people in this state. And we need to ensure that all our delegates who are going to be in Richmond are also supporting Terry to make sure that happens. And then, beyond all that, you could also volunteer to help roll out ACA. That's what I'm doing right now. Since the election was over, I switched over and I support Northern Virginia Family Services in helping people sign up for health care, talk to people about health care, and actually take them through that whole process. So if you're interested in doing that, you can do it as a speaker. You can do it as a certified application counselor, which requires you to take a online test and complete it and be successful to be able to do that. Or you could be a navigator, which is a higher level test, and you can do that as well. There are even some paid positions within Northern Virginia Family Services and other organizations. So some of them are part-time, and obviously they all end in March. Hopefully if everybody signs up, we'll be all set by then. But you need to make sure that you get out there and do that. And if you're interested, I have these flyers. I'll leave them in the back table about how to sign up and the different access points in English and Spanish. So, all Democrats support Affordable Care Act. We need to make sure it's successful, because we need to make sure that Obama's signature plan is successful going forward. Thank you.